हेलो दोस्तों, वेलकम टू मिस्टर वैभव भोसले प्रेजेंट नर्सिंग ज्ञान। और आज की इस वीडियो में हम देखने वाले हैं 20 मोस्ट इम्पॉर्टेंट MCQs अबाउट ह्यूमन रेस्पिरेटरी सिस्टम। सो लेट्स स्टार्ट विद वन बाय वन। The first MCQ is, what is the primary function of respiratory system? Options are circulating blood, digesting food, exchanging gases and producing hormone. And the correct answer is option C, exchanging gases. The respiratory system allows oxygen to enter in body and carbon dioxide to exit through the breathing. So the correct answer is option C. The next question, which structure is also known as windpipe? Options are larynx, pharynx, trachea and bronchi. And the correct answer is option C, trachea. Trachea is the airway that connects the larynx to the bronchi, allowing air to pass into the lungs. So the correct answer is option C. Trachea is also known as windpipe. Moving towards the next question, question number 3. What are the tiny air sacs in the lungs where gas exchange occurs? Options are bronchi, alveoli, capillaries and bronchioles. And the correct answer is option B, alveoli. Alveoli are small sac in the lungs where oxygen is absorbed into the blood and carbon dioxide is released. So the correct answer is alveoli, option B. Alveoli are tiny sacs in the lungs. Question number 4. Which muscle plays a crucial role in breathing by contracting and relaxing? Options are heart, diaphragm, stomach and trapezius. And the correct answer is option B, diaphragm. The diaphragm contracts to pull air into the lungs and relax to push air out. So the correct answer is option B, diaphragm. Question number 5. Which part of respiratory system prevent food from entering the airway? Options are epiglottis, larynx, pharynx and uvula. And the correct answer is option A, epiglottis. Epiglottis is a flap that closes over the trachea during swallowing to prevent the choking of food. So the correct answer is epiglottis, preventing the food from entering the airway. Question number 6. How many lobes does the right lungs have? Options are 1, 2, 3 and 4. And the correct answer is option C, 3. The right lung has 3 lobes while the left lung has only 2 due to the space for the heart. So the correct answer is option C. There are 3 lobes in a right lung. Moving towards the next question, question number 7. Which gas is exhaled in the highest concentration compared to inhaled air? Options are oxygen, nitrogen, carbon dioxide and hydrogen. And the correct answer is option C, carbon dioxide. It is produced as a waste product of cellular respiration and is expelled from the lungs. So the correct answer is carbon dioxide, option C. Moving towards the next. What is the main site of oxygen transport in the blood? Options are white blood cell, platelet, red blood cell and plasma. And the correct answer is option C, RBCs, red blood cell. It contains the hemoglobin which binds to the oxygen for transport. So the correct answer is red blood cell are a main site of oxygen transport in the blood. Moving towards the next question. Which structures serve as a common passageway for both air and food? Options are esophagus, trachea, pharynx and larynx. And the correct answer is option C, pharynx. Pharynx is a shared pathway for both respiratory and digestive system. So pharynx is a common passageway for both air and food. Correct answer is option C. Which part of brain control breathing? Options are cerebellum, medulla oblongata, hypothalamus and cerebrum. And the correct answer is option B, medulla oblongata. Medulla oblongata regulates the involuntary breathing by detecting changes in carbon dioxide level. So, medulla oblongata controls the breathing. Moving towards the question number 11, what is the function of cilia in the respiratory tract? Options are producing mucus, filtering dust and debris, exchanging gases, and increasing oxygen level. And the correct answer is option B, filtering dust and debris. Cilia traps and removes the foreign particles to keep the respiratory system clean. Cilia means small hairs in nose. Moving towards the next, what is the term for normal breathing? Options are apnea, eupnea, dyspnea and tachypnea. And the correct answer is option B, eupnea. Eupnea, it is referred to the normal and unlabored breathing. Apnea means absence of breathing, dyspnea means difficulty, and tachypnea means breathing rate increase. So the correct answer is option B. Question number 13. Which condition is characterized by inflammation of bronchial tubes? Options are pneumonia, bronchitis, asthma and tuberculosis. And the correct answer is option B, bronchitis. Bronchitis causes inflammation and mucus buildup in the bronchi, leading to coughing. Itis itself is called as inflammation. So inflammation to the bronchial tube is called as bronchitis. What is the primary cause of emphysema? Options are bacterial infection, smoking, viral infection and autoimmune disorder. And the correct answer is option B, smoking. Emphysema is a lung disease. It is caused by smoking that damages the alveoli, which reducing the oxygen exchange. So the correct answer is option B, smoking causes emphysema. What happened to diaphragm when you inhale? Option, it contract and move downward. It relaxes and move upward. It expands sideways and it remains unchanged. And the correct answer is option A, it contracts and moves downward. Explanation, this movement increases the lung volume and allowing to air to enter inside. So the correct answer is option A. Question number 16, what is tidal volume? Options are total lung capacity, amount of air exchange per breath, the air left after exhalation and the forced air exhale. Correct answer is option B. Tidal volume means the amount of air exchange per breath. It is air inhaled or exhaled in a normal breath. So the correct answer is option B. Which lung disease is caused by Mycobacterium tuberculosis? Options are asthma, pneumonia, tuberculosis and COPD. Correct answer is option C, tuberculosis. Tuberculosis is infectious disease caused by Mycobacterium tuberculosis affecting the lung function. So the correct answer is option C. Question number 18. Which structure in the lungs helps oxygen to diffuse into the blood? Options are capillaries, bronchioles, larynx and trachea. Correct answer is option A, capillaries. Capillaries surrounding the alveoli, allowing oxygen to enter the blood stream. So capillaries helps to oxygen to diffuse into the blood. Next question, what is the main function of surfactant in the lungs? Options are transport oxygen, prevent alveolar collapse, increase lung stiffness and remove the carbon dioxide. Correct answer is option B, it prevents the alveolar collapse. Surfactant reduces the surface tension in alveoli and preventing them from collapsing. So the correct answer is option B. And the last question, which gas in cigarette smoke reduces oxygen transport in the blood? Options are nitrogen, carbon monoxide, oxygen and carbon dioxide. And the correct answer is option B, carbon monoxide. Carbon monoxide binds to hemoglobin more efficiently than oxygen and reducing the oxygen transport in the blood. So the correct answer is option B.